All right, are you ready to go?
It's recording.
Oh, we're recording, okay. All right, so we are recording this talk. None of you will be on it, but we're basically doing it because all those people that couldn't come said, you guys should, I'd love to hear it, I want to hear it. So we decided, well, we'll just record it, and then that way people can watch it. Okay, so we do want to thank each of you three for coming and Allison for staying. We know you all have really super busy lives and you could be elsewhere, and we appreciate that you guys want to know our knowledge on this subject. So we do thank you. Also, Dr. Marley handed out PowerPoint slides of our presentation tonight, so if you wanted to jot something down, if you're confused about something that we say, or you want to take a little note, or even if you have a question at the end, we'd be happy to answer any of it for you, okay? All right. So, ear infections. Do any of you guys know that actually ear infections are the most common reason that children visit their doctor? The most common reason. Well, you work daycare, so you probably see it.
Preschool.
Yeah, that's what I meant. Sorry, I didn't mean to say that. Preschool. But yes, you see that all the time. Okay? So they're just super, super, super common. Now, some more statistics about ear infections. There's 10 million new cases of ear infections every single year, and they cost the U.S. nearly $3 billion annually. It's a lot of money just for ear infections, okay? Like I said, they're the most common illness affecting babies and young children, and they're the #1 reason that a child visits their pediatrician. They account for 35% of all pediatrician visits, just ear infections, okay? 50% of children will have at least one diagnosed ear infection by the time that they're 1, and 2/3 of children will have at least one diagnosed ear infection by the time they're 3. So it affects a ton of kids, okay? And the reason this is important is because if ear infections become chronic, which often they do, it leads to the fear of hearing damage, speech delay, and developmental problems. So that's what everybody's trying to avoid when we treat these ear infections the way we treat them, okay? All right, so what exactly is an ear infection? To break this down for you, here it is. Otitis media is the proper term for an ear infection. Are you okay? It's okay. Okay, so oto means ear, itis means inflammation, and media is middle. So it's inflammation of the middle ear, okay? Now, this is very different from otitis externa, which is inflammation of the outer ear, which is commonly called swimmer's ear. So you just, when people say that they have fluid in their ear, that's external, okay? Middle is in between the eardrum and like the inner ear, where all the ear bones are. There's 3 of them, auditory ossicles. But anyway, the reason this hurts is because your eardrum here has a very, very intense nerve supply. Tons of nerves go to the eardrum. That's how we hear, right? But they also sense pain. So a lot of times this inflammation in here causes pressure on the eardrum, hence why we have pain, okay? Discomfort. What causes ear infections? There's 2 culprits, okay? It's either virus or bacteria. Now, depending which research you look at, it's very, very conflicting with which is the more common culprit, okay? A lot of research finds that most ear infections are virus, then a lot of research finds that most ear infections are bacterial, okay? So that's difficult for me to actually say like, hey, they're usually one or the other, okay? Another contributing factor to ear infections are the way that children's eustachian tubes are more horizontal, whereas adults are more vertical or more slanted. But this is tricky because people they like to blame that, right? Well, yeah, kids have more horizontal, eustachian tubes so their ears don't drain. Yeah, that's one reason and it's a contributing factor, but that in itself does not cause ear infections, okay? If that was a cause, every kid would have one, okay? Every single kid. Now, it's important to know, too, that gravity plays an important role in draining of the eustachian tube. But not just gravity itself, but actually motion. And more importantly, motion of the spine, especially the top 2 vertebrae, which we will talk about later, okay? All right, now how do we in America tend to treat ear infections? The traditional medical model here is it begins with antibiotics. So the very first treatment is an antibiotic. Now it's important to know that antibiotic literally breaks down into anti-life, okay? So when you take an antibiotic, not only are you just killing that bacteria that you're aiming to kill, if it is a bacterial infection, but you're killing all the other bacteria in your body as well. And that bacteria is super important for your immune system. It's your good gut flora. We'll talk about that more later, okay? Now, we treat every ear infection mostly with antibiotics. However, prescribed antibiotics have only been proven to help a very small number of children with their pain or their infection. And the research all the way back since the 80s has continually proven that antibiotics are very poor at treating ear infections, upper respiratory infections, and sinus infections, but they're always readily prescribed, okay? That's part of the problem. Okay, now prescribed antibiotics, like I just said, are not proven to be successful at treating ear infections, yet they're constantly prescribed as the #1 tool. Why? Why don't they? Okay, so number one, does everybody in here know that antibiotics don't treat viruses? Okay, a lot of people don't know that, shockingly. People think that antibiotics are just what you take when you're sick, but they shouldn't be. They should be what you take when you're sick with a serious bacterial infection. Not with a, hey, I don't know, might be viral, might be bacterial, take this, okay? Because what happens with that is if it's caused by a virus and not a bacteria, then all you did was literally make the situation worse. Because now the antibiotic is doing more harm than good. Because what it's doing is killing off all your gut flora and all the good bacteria in your system and making your immune system crash, okay? And then now you or your child is susceptible to more infections because you don't have any of that good gut flora anymore, okay? So, also don't forget, antibiotics are a drug and they do come with side effects, okay? Some small, some short term, some long term, but we gotta remember that you can have upset stomach, vomiting, diarrhea, skin rashes, yeast infections, even seizures. I can't tell you how many times I have little kids come in here who have been put on an antibiotic, sometimes more than one, for an ailment, and now they're dealing with all these other gut issues, you know, that their moms don't know what to do about, okay? Now, even if the infection is bacterial in nature, like I said, research actually shows that antibiotics don't always do their job, and sometimes your own body is more effective at killing off that bacterial infection than the antibiotic is itself, okay? Now, the American Academy of Pediatrics, which is a medical association, recommends a watch and wait approach when treating ear infections. If you look in their book, that's what it says, watch and wait. The problem is most doctors aren't following their own academy's recommendations, but it's not always their fault, and we're going to talk about that. Okay, so we have a huge overprescription of antibiotics, a huge overprescription of all sorts of drugs in our country, right? Who's to blame for this one? Obviously not just the doctors, but the parents, right? Okay, because what happens? We take our kid to the doctor hoping and requesting and expecting an antibiotic or a drug or some sort of something quick to make my kid feel better. That's just what we do. So we expect antibiotics when our kids are sick, right? So we're tired, we aren't able to work, we're heartbroken our kid is sick, we're missing out on a paycheck, and we feel sad that our kid doesn't feel good, so we tend to look for that easy fix, right? Now, also remember, when we go to the medical doctor, what is the tool that they can provide? Medicine, right? I mean, what else do we expect from them, right? So if you actually take your kid to the medical doctor, you're not expecting advice, right? You're expecting medication. So that's what happens, okay? We have to remember, though, that health does not come from a bottle. It just simply does not. It comes from inside, and Dr. Marlo's going to talk about that more in just a minute here. This is the #1 thing, though, that's super hard, especially for first-time moms and parents, is that we have a really hard time trusting the innate intelligence of our child's body, that they can actually get over these things on their own. We have a hard time, but we need to work on that. We need to trust that more, okay? All right, now oftentimes these antibiotics are doing more harm than good. We've talked a little bit about this, but just to branch off over it a little bit more, overprescribing antibiotics is the root cause that we have superbugs, okay? We have these drugs that literally we have little resistance, or we have little medical defense against them, right? Because they are so strong at combating antibiotics that the medical profession has to throw the strongest, most heavy-duty antibiotic in your system to get rid of it, right? Like C. diff, that's one major one. That's a huge, nasty bacterial infection that we have to throw nasty, nasty drugs at to get rid of. MRSA, I mean, those sorts of things, okay? Like I said before, antibiotics kill your normal gut flora. That is what you need. And actually, most people don't know this, but between 70 to 80% of our immune system lives in our large intestine. That's where those bacteria live, and that's where the fighting takes place to keep us healthy. So if we kill all those bacteria, we've got to rebuild that up, okay? Now, oftentimes several rounds of antibiotics are prescribed for one single infection because of this evil cascade of taking the drug, getting yourself knocked down, and then getting sick again, or not ever getting over it in the first place, so then you get on another drug, kill off more bacteria, and it's just a downward spiral, okay? This is also super important. You know, back when my parents were raising us, doctors were saying, yeah, start giving solids at 4 months, you know, give rice cereal at 4 months. it's not fair because the infants don't even have a properly, fully developed gut at that age. So they can't even secrete enzymes to digest those foods at that age. So we shouldn't be giving our kids any sort of solids until they're 6 months old. Why should we give them drugs that their gut has to break down before they're 6 months old? And there's kids on drugs before that age all the time. It's really sad, okay? All right, so now, if antibiotics don't work, the next step is surgery, right? But surgeries are invasive, they're scary, and sometimes they're ineffective, and they're always costly, okay? Now, if, like I said, failed antibiotics treatment leads usually to surgery. And actually, frequent ear infections are the second most common reason for surgery in children under the age of 2, with only circumcision being the first most common, okay? So, other than a surgery that, you know, most of America chooses to do right at birth, tympanostomy surgery is the number 2, okay? Super common. All right, this procedure actually requires that your child be put under general anesthesia. For any parent, that is scary. I mean, that's major, right? And what the surgeon's gonna do is they're gonna go puncture your child's eardrum and put a tube in it, so that their hope is that this will aid in drainage. Now, it's important to understand, though, that this is a ventilation system. So when they poke a hole in the eardrum, they don't hope that the fluid drains outward. Their goal is to get it to drain downward, right? So kind of like, oh, we're all women in here, okay? A big old jug of laundry detergent, the liquid kind. If you push the spout and the cap's on super tight, the liquid doesn't really come out, right? But if you loosen that cap and then push the spout, it flows out. That's what I mean, like the ventilation system, like a gas can. If you don't vent the gas can and you try to pour the gas out, nothing's gonna come out, right? So they're venting your ear tube to hope that it'll drain, but it's gonna drain down, not out, okay? What happens with this is you're getting lots of extra drainage now down your throat, okay? So this leads, I mean, obviously now all that extra drainage is hitting your tonsils and your adenoids instead of staying in your eustachian tube, so now you've got tons of throat infections, okay? This is the next stage of the cascade, or what we call the perfect storm, okay? Also important to know that this tympanostomy surgery heals with scar tissue, so whether your doc punctures your eardrum with a little puncture tool, or your eardrum ruptures because it had a massive infection and it just blew up, it's going to heal the exact same way. So you're just as likely to go have hearing damage in your ear whether it ruptures on its own or they rupture it. And that is one tool that they'll say is, we got to put tubes into your child, we don't want their eardrum to rupture and them to go deaf. Well, sorry, but they're just as likely to go deaf or lose hearing either way, okay? Now, some ear tubes are meant to fall out on their own within 6 months, but most are meant to stay in until they're removed, okay? The problem with this surgery, one of the problems is, it actually is failed and repeated 20 to 30% of the time. So when that happens, surgery fails, right? Okay, so what happens? Then you usually go in for another surgery of ear tubes, and they say, all right, while we're in there taking those ear tubes out, we better take out your adenoids and tonsils, because now you've got tons of throat infections, and your tonsils are so thick, so fat, that you're having breathing problems, so we better take those out. Here's the issue. Your child gets ear tubes, okay? The parents are like, well, I can't really tell, I think their ears might be better, but they're having so many problems in their throat. They snore at night now, they don't get restful sleep. I don't think they can breathe very well. Hello, their tonsils and adenoids are hugely inflamed now because all that drainage is going down their throat, okay? These tonsils and adenoids, though, are some of the body's first lines of defense when you take anything in. They're hugely important lymphatic tissue. So when we take them out, it's crazy because now you don't have that first line of defense in your throat, and any sort of pathogen that enters our mouth now goes straight to our lungs, okay? Because we don't have that to fight it off. So it's crazy to me that the medical world thinks we have like all of these organs in our body that are dispensable, right? Your appendix, your gallbladder, your tonsils, your adenoids, like they're so easily removed, but all of these, every single one of those organs serves a purpose, right? Were we just born with a bunch of extra parts? No, okay? All right, so now we have all these chronic lung issues in this poor little kiddo because he has ear tubes, no tonsils, no adenoids, and now just all that stuff is going down in his chest, okay? So now this little kiddo is probably going to have to be taking asthma and allergy medications for the rest of his life. And that's why we call it the perfect storm. So ear infections basically started out as an acute problem, right? But the way that we treated it led to this perfect storm of now having chronic issues for the rest of his life that he can't probably do anything about. There's no reversing that, okay? All right, typical scenario, let's just walk through it. Child begins to show symptoms, you know, they're tugging on their ear, they're fussy, they can't sleep, they probably have a fever. Mom feels really helpless, really concerned, okay? So she calls a pediatrician, she takes the earliest available appointment. They go in, pediatrician gives a diagnosis of an ear infection. Now, sometimes this is based off an otoscope exam, which is, you know, they have to look in your ear with the little scope. The problem is, A, if the little kiddo's been crying a lot and they're uncomfortable, that eardrum's gonna already look red because of the increased pressure in your head from crying. Number two, I mean, I look in kids' ears all the time and hear some of them are not very cooperative, right? They don't want it, they're batting away, they're crying. It's like, how many times the pediatrician actually gets a really good look at that eardrum? I don't know, but I'm guessing based on my experience, it's not really high, okay? But they do get the, you know, a lot of times they'll say it's probably an ear infection. So even if the pediatrician says, well, it's an ear infection, let's wait it out, most time parents say, can't you just prescribe something just in case? Can't we just try something? So they do, okay? Child doesn't usually fully recover from that ear infection, so they're put on a second round of antibiotics, usually something heavier duty, okay? And then this can be repeated, you know, 3, 4, 5 times before finally their pediatrician says, well, I'm going to refer you to the ENT. So you go to the ENT, they look through your case history and say, yeah, looks like your kid's a case for tubes. I can schedule surgery as soon as your convenience, right? So never during any of this cascade, though, have they said, have you tried anything holistically? Never. Because, guys, we see this all the time, and I wish I could say, oh, yeah, I get referrals all the time from docs for ear infections, but I don't, and I usually get them way after the fact, okay? So now the worst case scenario is that tympanostomy surgery failed, and now the kid's got hugely swollen tonsils and adenoids, and they have to get those taken out. And now this little kiddo has chronic swelling and issues in their lungs, okay? So I actually just read a statistic last week. Does anybody know the percentage of our human population that actually needs a tonsillectomy because of tonsil issues and real breathing issues? Less than 1%. Most time kids grow into their tonsils between age 8 and 9. So while your tonsils can be hugely overgrown when you're little, most likely by the time you get to 8 or 9 years old, you're going to grow into them. But you don't ever get that chance. And the ear tube just blows them up even more. So it's kind of a wicked storm there, okay? Look at Quinny. So here's the thing, chiropractic, it's gentle, it's natural, it's non-invasive. Most kids love being adjusted, hence Quinn there. Okay, so what is chiropractic? You all know that because you come in here, but we want to break it down to you for 3 simple steps. Number 1, the body is self-healing and self-regulating. So what we mean by that, if you fall, Jill, and you scrape your knee, is it going to heal with or without Neosporin?
It'll heal without it.
Right, what about with a Band-Aid?
It'll heal without
Exactly.
it.
Okay. Sam, you just ate dinner tonight, right? Do you have to tell your body how to digest that food you just ate, or is it going to figure it out?
Hopefully it'll figure it out.
Yeah, you don't have to help, right? Annalyn, you're breathing back there. Are you having to regulate your blood oxygen level, or is your body doing it for you?
I'm pretty sure it's doing it for me.
So it's pretty cool, right, how that all works out. It's awesome. Now, the nerve system is the master controller of the body. So it's actually the first system in utero to develop because literally every single other system in our body depends on our nerves. So with those 2 things there, here's the caveat. Now, if you have interference to your nerve system, the body can no longer self-heal and self-regulate as properly as it would if you didn't have the interference, okay? So those are the 3 main things. Now, misalignments within the spine or subluxations are actually causing that nerve interference and causing the decreased ability to heal and regulate properly, okay? So what do? We work to remove the interference by adjusting the spine and removing the subluxation, okay? What's a subluxation? Well, one more time, 3 simple things. It can be broken down into a misalignment, so it's a joint, 2 vertebral bones that are misaligned, okay? Because of that misalignment, they're stuck. They're fixated, okay? They're not moving properly. And because of that, there's nerve interference, nerve damage, and dysfunction, okay? So these 3 things lead to dysfunction in the body. How does that play in this case? Well, the adjustment as far as to the kiddo with ear infections. What our goal is to decrease nerve interference, okay, and increase immune system function, which Dr. Marley's going to talk to you about in just a minute here. But let me break this down a little bit. So you have upper cervical vertebrae, C1, C2. So these are the very, very top bones here in our neck, right? C1 sits right under the occiput, C2 is right there with it. Now, if you guys all will take your fingers and put them under your earlobe, just under the earlobe, you're all touching your C1 right there. So can you see how close that is to your eustachian tube? Super close. So obviously just the proximity correlation is huge, right? But what we're actually finding through not only just working in here, but scientific research is finding that these nerves that come out of C1, C2 share a huge part of their nerve supply to the ear, okay, to the tympanic membrane, to the eustachian tube, okay? So not only, obviously, if these bones are functioning and moving properly, the nerve supply to the ear is functioning and working properly. So that's number one. Number two, if these bones are fixated, stuck, misaligned, and subluxated, then they're not moving correctly, right? So that in itself is causing the eustachian tube to be more stagnant because the movement of these bones up here helps the eustachian tube pump and helps it move fluid out, okay? So if they're stuck, eustachian tube is most likely stuck, okay? And the longer that the eustachian tube is stagnant, the more likely that fluid gets stay in there and build up an infection, okay? So we help by number one, adjusting to improve nerve interference to the area, but number two, by improving motion to the area, and that in itself helps the tube drain better, okay? All right, now let me just make sure I got all that. I think I did. Okay, perfect. Now where did I put my pointer? Oh, okay. All right, so last thing, what causes subluxations in kids? I mean, number one, kids are kids, right? So we watch how many kids fall on bicycles, learn to walk, fall over. See, you've told me you've seen kids face plant off slides. I mean, like, kids are kids, right? That's part of it. But if we jump way back, some people don't think about this, but it's actually common to get subluxated in utero. I mean, people who come in with breech babies, or they say they pushed for 3 hours, but the doc said the baby was stuck, or they came out sunny side up, so completely an extension, right? I mean, all those sorts of things with all the, if you think of the birth process itself, I mean, that in itself actually can be your first subluxation, okay, in utero. Number two, toxins in pregnancy. I don't know what the moms are eating or what they're being exposed to or their emotional stress. All that stuff plays into what the baby gets, okay? Then finally, birth trauma. I mean, even non-complicated vaginal, non-medicated, healthy births can be traumatic, right? So when you think about the other ways, I mean, forceps, vacuum extraction, pulling and twisting the head and neck, and then a cesarean, I mean, that stuff is very, very, very traumatic on the children's spine, and if you've seen videos of it, which I'm sure most of you have, you can understand why that in itself can cause a cervical subluxation in a kiddo, okay? All right, so just a couple things here. Research on chiropractic and ear infections is awesome. There's tons of it, but I just cited one source here. There was a study published in the Clinical Chiropractic Pediatrics that showed that close to 80% of children did not suffer from another ear infection within 6 months after stopping chiropractic care. So it wasn't just one adjustment. They were getting a series of adjustments, but close to 80% of the kiddos didn't even have another ear infection after the chiropractor released them. Within 6 months. They stopped following after 6 months. But that's pretty cool. And actually, ear infections in chiropractic is gaining a lot of buzz. So a lot of times we get phone calls, hey, do you guys treat ear infections? You know, and then we have to explain we don't treat them, but yes, we do see ear infections in here. So some other natural ways to prevent ear infections are prolonged breastfeeding is awesome. They don't call it the golden pint for nothing. I mean, that thing is stocked full of good bacteria, antibacterial stuff, antiviral, just very health-building properties for the baby, okay? Lots of veggies, lots of fruit. We need to push that a lot. I put veggies in front of fruit. Dr. Marley will talk more about that. Fruit has a lot of sugar, so we need to be eating more veggies than fruit, okay? Make sure your kiddos are washing their hands, especially as they're learning to potty train or if they're going to daycare. Hygiene is super important. And then at all costs, avoid secondhand smoke, okay? Kiddos do not need to be around this. This is directly correlated to ear infections, like hand in hand. So if your parents are, you know, if the parents have the car windows up and they're smoking with the kiddo in the car, they smoke in the house at home. I mean, even third-hand smoke, so the smoke you smell on the furniture, is related to ear infections. So it's always super hard when we see this in here because we know that's a huge factor going against what we're doing, you know. So those are a couple gems there. Now, Dr. Marley's going to take over, talk to you about ear